I'm here with Jan Oldenburg and Mary Griskewicz to hear more about their upcoming patient engagement book. So you both have a book coming out about patient engagement that's kind of a companion book to your first one, Jan. So could you tell us a little more about the book itself?
So with our volunteers, patient engagement is actually a movement. It is really resonant with our members that providers must learn how to truly engage in the digital health ecosystem with the patient. So the first book was written as a pledge to the Office of the National Coordinator for their eHealth pledge to say that HIMSS would create resources and tools to support the provider community so they could understand why and how information technology can help them.
And I actually like to think of the first book, Engage, as the business case for patient engagement and why it's important and why there are actually benefits to everyone in the system. But when we thought about this book, we felt as if it was important also to take the perspective of patients and caregivers and provide real insights in their voice to the health systems, to the payers, to the providers directly. Because often we talk about them as our customers, but we don't really do a good job of listening to them.
Now I know you touched upon it a little already, but this is a little different, that it has more stories of the patient side of things. Why this book in general? You know, where did this all come from?
Looking at where we've been in the last couple of years with the release of Meaningful Use Stage 2, now looking at Meaningful Use Stage 3 proposed rule and the new flexibility rule, it's more important right now to truly have the patients and their healthcare representatives indicate why information technology is so important to them. The entire ecosystem must be used. Data needs to be turned into action, and we need the information in the community. We feel that this is part of the HIMSS mission to educate not only our members as providers and clinicians and information technologists, but truly as patients and consumers as well.
I think one of the things that happens when you start talking to real people about their experiences in healthcare is you start realizing how much of what we take for granted is really a hassle when you are standing in the shoes of being a patient, being a caregiver, worrying about someone that you love. And as we think about what that means, it's really requiring us to re-engineer all of the things that we deliver from the standpoint of what would convenience for patients and caregivers look like? What would it look like if we were designing it around them rather than designing it around our convenience?
This is about patients, patient engagements, and HIMSS members, a lot of providers, CIOs, IT. Why is this book important for them?
Because they need to continue on that journey. Most of health and healthcare occurs outside of the acute care setting. It's about care coordination, going beyond the walls of the hospital, expanding your services that you provide into the community, making sure you're meeting the population health needs of your community and looking at the mission of your organization. And the best way to do that is to activate your patients and to work with them so that they utilize your services. They understand what you have to offer, and the best way to do that truly is through information technologies.
So thank you to you both for being here with us today. We appreciate it.